I have tremendous respect for the Spiritists, and I feel that they are truly brilliant in terms of helping people who move into this zone where they have severe mental disturbance, and especially those who have a psychotic process and are hearing voices, because they can recognize someone who has what they call repressed mediumship. Someone who is hearing voices and is clearly needing to develop them and develop their shamanic abilities, or whatever you want to call it. So they can recognize those people and give them adequate care and training. I don't know where that's being given within the context of a community center and a hospital, anywhere else in the world. You usually have to go into the indigenous cultures to get that. So they're brilliant in that particular arena.
Some cases that the person became healthy. You know, some of the mediums that were working with us, and now they are really normal persons living their lives with the family and job. Many of them, they used to be psychiatric patients. They discovered they were just mediums. You know, Dona Eliane, she passed a long time of her youth in a psychiatric hospital. They said she had an schizophrenia, and now you saw Dona Eliane Crespo. She's so normal person. She has a large family, and she works until today, and she has all these groups that she supervision of all these groups. She's a normal person. When she was a youngest, she used to hear voices and to see the spirits. And they took her to this psychiatric hospital. She was there for a long time. And then someone took her to a Spiritist center, and she had developed her mediunity, a very important mediunity, and now she's fine. So it's a big example of this. But many of the mediums that now are working here as volunteers, many of them, they used to have a diagnosis of psychosis in the past, because they were mediums and they could see, and they could see spirits, and they could hear them and talk to them. So many of them had become psychiatric patients in normal hospitals. Some of them came to this house or other Spiritist centers, and then they had developed their mediunity, and now they are normal persons working with their mediunity. So this happens in our country. You know, we have histories about that in our country. The mediunity in Brazil it's not. It could be from the beginning if the person doesn't understand what's going on with him, with her. So perhaps it's a cause of much disturbance. But also we can say that being a medium is very accepted here in this moment in Brazil. But nowadays, if you are a medium, you are accepted. You have the mediunity as a gift.
I think that the health providers who are drawn to learn here from Spiritism acknowledge that our system may be completely broken and we need a whole other vision about how to work with people, or it's just lame and we need some other perspectives and other treatment protocols. So they're people who care very deeply that they can offer the very best that's available to their own patients. And I think they're also, for the most part, people who've done their own personal search. They may be wounded healers, but they've done their own personal search and just felt there is something else. Somehow, the way we've been diagnosing and treating people does not meaningfully include spirituality. And yet spirituality has been known to be a tremendous resource for helping people with mood disorders, anxiety, depression, and panic disorder, etc. But if it's worked for that, it can possibly work for other things as well. And what is the potential of spirituality in terms of assisting? So these health providers are not people who say spirituality is the only thing that's needed, but an integrative approach. So we need to look at the biology, the psychology, the social network that a person has, as well as the spirituality. I felt that everybody there was extraordinarily compassionate, but that's what the Spiritists are doing, is that they are literally growing that within themselves. Kardec believed that, and transmitted in all of his writings, that the goal of life is to become more compassionate and wise. So all of the treatments, all of the activities are designed to assist people to move more in that direction without hammering on them with dogma